Hi, and welcome. This is MassBio's SEF Forum. I'm Denise Aronson. I'm the CEO of Safety Partners, and welcome to MassBio's Safety, Environment, and Facilities, that's SEF. We are a committee that puts on forums a couple times a year. And again, I'm Denise Aronson. I'm a co-chair of the SEF committee. And today we're presenting COVID-19, how's your reopening going in the biotech labs in Massachusetts? So this forum has breakout rooms so that we can discuss challenges, and we also have a couple experts ready to share lessons learned. Before getting started, just quickly, I thank Chris Lindgren, MassBio's Director of Programming. She's the one behind making these forums happen, and it's wonderful to have her leadership and coordination to help the SEF committee put this together. And then I want to introduce my co-chairs. We have Elias Whitman of Sanyo Bio, Isabel Johnson of Thermo Fisher, Adam Weiner of Vertex, and Shaina Jamani of PHC Panasonic. So that's who we are. Thank you for joining us. Our mission here at MassBio's SEF is to share best practices in our world of EHS, sustainability, and facility operations. If you have ideas for forums, please reach out to MassBio, and Chris will be sure to funnel those suggestions back to SEF so we can work on forums that you are interested in. Okay, now I just want to quickly introduce our two very important people for today, our experts. And we have Caroline Slater, Director of QRT at Safety Partners. Caroline oversees Safety Partners' COVID-19 plan delivery across 200 clients inside and outside of Massachusetts for Safety Partners. And we have Rhonda O'Keefe. She is the Director of EHS at the Broad Institute. I think I first met Rhonda in about 1994, maybe, in One Kendall Square. Across the hallway, she was with a company that I don't remember. Oh, no, I don't. CNS.
Neuroscience.
Oh my gosh, CNS, yes. And I was across the hall at Mitotics, and I've long enjoyed and admire Rhonda. She is a really excellent EHS person. And thank you, Rhonda, for being here. She is the director at the Broad Institute. She has led the creation and rollout of the action plan across the Broad, which is a large academic research organization. So between Caroline and Rhonda, we have two experts with a little bit different outreach. So thank you both for being with us today. So, okay, let's get started. Our forum today is COVID-19, how's your reopening going in your biotech labs? So what we want to do is Caroline and Rhonda want to hear from you, all of you, what your biggest challenge is. So you're going to have to narrow it down to one challenge. I know that will be hard, but that's the way this is going to happen. So in a couple minutes, we're going to move into breakout rooms. I think there's going to be between 4 and 8 people in a breakout room. And luckily we have Jess at MassBio who's going to do this technology for us. If you haven't already, there are 3 dots in your upper right-hand corner of your square. And if you put your company there, you can hit rename and make sure your company is part of your name. That way in the breakout rooms, we're going to try to divide it up so that we don't have several people from the same company in a room. Okay, so let me just describe the flow of the forum today. So let's see. Okay, in a couple minutes, we're going to do the breakout. In each breakout room, there's going to be a moderator. You may actually see Rhonda and or Caroline in your room, and they are going to be listening, but don't start nudging them for answers yet. So they may be silent. We just want them to be able to listen and be part of this. But really what we want, so don't be bugging them because we want their answers so that everyone knows them. and hears them. So that will happen. The breakout's going to be for about 15 or 20 minutes. So I suggest that you go around in your room and introduce yourselves to each other, and then your assignment is to discuss as a group your challenges in this return to work or scaling back up if you never left the lab. So what it means to work today in this pandemic in our stage 3, I think, of the government's reopening requirements. So how's it going? Discuss what your challenges are. The moderator needs to help you come to a decision of what your one largest challenge is, what is the most difficult or one you want as a group to present to the experts. So after 15 to 20 minutes, we'll go back to the open forum. And during that open forum, the moderator will have a chance to describe the challenge. So every room is going to have their challenge to put upon the experts, and we'll have them consecutively listed, all those challenges. And then Caroline and Rhonda are going to start sharing thoughts and what they think about some of these challenges, and hopefully present opportunities and challenges. So moderators, just letting you know, your job is to be timekeeper and scribe, keep the group focused, and then when we go back to the open forum, you will be the one to present the group's one challenge. So because this is a webinar, I can't say, do you have questions and whatever. So I am going to assume my instructions were relatively clear, and we can begin.
All right, and it's Chris with Mass Bio. I'm just checking in with Jess. How many people do we have in a room? Is it looking?
About 5 to 6 people.
Okay, perfect. Do we want to set it at 15 and have more time for discussion then?
Sure, I'll put down 15 minutes here and then a 2-minute
All
mark.
right. So it's going to go fast, everyone. But we can do a lot of sharing afterwards. So Jess, whenever you're ready.
Sure, just 1 second. You should get a notification on your screen. You can just accept it.
And hit your join. Yep.
Melissa? Melissa and Adam, can you hear me?
Hello?
Hi, we just put
Hi.
everyone in breakout rooms. Let me try to
Okay.
assign you here. 1 second. June 2. Aaron. 2 to 3. All right, you should. And Jeff, you should have seen a notification to go to your room, and Danielle too to go to your room. Your breakout room. Or maybe I didn't assign you yet. 1 second, let me put you in a room.
Sorry, I was connected via my phone and then got
Okay,
out.
that's fine. Let me put you in a room right now.
Okay.
Adam, I just noticed you weren't in your room. Okay. Yep, I'm putting you in. Sorry, Chris Lindgren. You're on mute, so I can't hear you. Adam, Caroline.
Sorry, yeah. I ended up moderating that because Adam didn't, I think Adam ended up with Isabel, which is fine. But Caroline was in there, so she probably took over after I left.
Oops, sorry. Okay, so Caroline, number 8. I'm going to put you back to Adam's room.
Yeah, no, not Adam's, the one with Caroline Slater.
Okay, Adam is now, okay, I got it, Caroline Slater. He's now there, but okay.
Oh, he was with Isabel Johnson. He was in that room when I just went over there. And now he's with Caroline?
Yes, he was always there. He just never accepted my room invitation.
Oh.
That's why I moved you.
Well, put me in with Caroline, and if there's any
Okay.
issues, I'll come back out.
Yeah.
It's an art.
Everything was good, but I'm like, why didn't he accept his thing? Okay,
I know,
you're
yeah.
back with Caroline. Caroline Slater.
All right. I don't see anything telling me to leave yet.
It says you haven't joined yet. I put you in there though. You didn't get something on your screen?
Do I hit, there's a leave button. Should I hit that?
Yeah.
It says leave meeting though.
Oh.
That's right.
It shows that you are in that room, but it says not joined. You should have got something that popped up that says join room.
Didn't get my blue join button. That's okay. What's our, I can't see the time remaining.
6 minutes, 6 minutes and 30 seconds.
Yeah, okay. I mean, I can just,
I can make it, can I make it longer? I don't, if you want me.
it's fine.
Okay.
I mean, there were small rooms. I think that it's fine if we come all back together.
Yeah. More than half the people didn't put their names on it. So I was just more worried trying to get all the moderators.
Oh, I know. I mean, ideally, we want to just be able to hit automatic breakout rooms and then just make sure the hosts are in the room.
You should have that now that I look. You don't see the notifications to join the room because Adam is
No.
not in there. It's some other guy named Adam.
Oh, right, Adam Nagel.
Adam Nagel. Like, yeah, they didn't show the whole thing.
Take me out and try putting me back again. I just don't see any join prompt. I just see leave.
I can't. It says you're waiting to join number 8. I can't because you're not accepted.
Oh. Yeah, I don't see a thing. I only see my blue mute and I see the leave button, but that's leave. Let me try clicking leave again.
Yeah.
Yeah, it's leave meeting, which I think would put me out of Zoom. That's right.
It's not allowing me to move you just because I assigned you to 8 with Caroline.
That's okay. I think Caroline will keep that conversation going.
Okay.
I'm sure she is. Can I chat with her? Yeah. Well, she might not even look at the chat, to be honest, if they're talking. But anyway, I think it'll be fine when they come back out, you know. The problem with what in my room was it was all like, well, it actually wasn't a problem in a way. It's sort of, they were all service providers, so you have to talk about like, what is your biggest challenge as a service provider, and then what are you hearing from your clients? You know, it's kind of that two-pronged. There's actually a lot more to talk about than just one's not a problem. And then I've got my I've got my technical keyboard, my keyboard here. I think the battery's dead.
Oh no.
So that's why I have to keep moving the thing close to me so I can type. It's ridiculous.
This is so weird though. I'm just keep looking at here. I guess it's too late now. We have 4 minutes. I could try moving you to another room and then back to number 8 if you want. Because it says you're in the room you should be in. I can try.
Right, just to see for future reference, just so you can.
Someone's coming in. Should I maybe put them in that room?
Yeah, go ahead.
Okay, I'll put them in.
So we just got another person joining the meeting?
Yeah. I just moved you to 1. Now I'm going to move you back to 8.
Okay. Let's see if I get my prompt.
Yeah, you should get a prompt.
Don't see anything. So strange.
Do you have any other screens going on right now, or you just have your one?
No, it's just I closed PowerPoint. Like I said, the only thing I see is the lead, because the join usually comes up as like a dialog box, you know, with the white. It's a blue with the white box. I don't see that at all.
The way to end the meeting, the only one is the end button, the bottom right. You can leave, that's fine. You're leaving the meeting group.
Oh, okay, so I can
If
leave.
if it's not a red button, then it's fine.
It's red and it says leave meeting.
Oh.
So I'm thinking that's the whole thing.
Do you want to try that? And then if not, just sign back in and I'll admit you. I think it's really that.
That's right. I mean, we only have what 3 minutes?
Yeah.
I'm not going to add value, and you know,
Okay.
I think those guys probably carried on without me. They're fine. And then you just put a new attendee in that room, right?
Yeah.
Okay. That'll keep them busy for 3 minutes. And then James has to delete all this stuff because when we do the recording, I don't know if you've noticed it, that it only records obviously the main room.
Okay. So he
So
needs to edit it.
we end up getting like the intro with Denise, and then we'll have the readout part,
Yeah.
which is actually pretty interesting. Should be fine. All right. Well, thanks for helping. I know it's not easy. How do you guys do the trivia? Are you like, you have a professional person that asks, comes in and?
Yeah, somebody, I'm not going to bother putting this person in. It's only 1 minute left. So
You can put them in with us.
yeah, she'll just stay with us here.
Yeah, we can explain what's going on.
Yes, where were the breakout rooms? Before it told me the number of people in each room, and that
Uh-huh.
disappears. So I'm literally going through 1, 2, 3, 4, 5, 6, 1, 2, and I'm have to count it. So before it gave me the number, which was nice, and I don't know why it
You have
disappeared.
like 6 people in a room. My room was like 4. 1, 2. I mean, that's good. If we had some rooms with 6 people, that
Yeah,
should be,
some had 6.
that
I was
should be good.
counting the moderator, so really 5. You may
Yeah.
have had 4 then. It was either 5 or 6 with a moderator, so it was anywhere between 4. Yeah, with a moderator, 5 to 6.
Yeah, that's good. All right, and I can't see the. Yeah, so I'll let Leah know. I mean, since you guys moved the networking to the 13th, I can help if you need it for that.
Okay,
But I do think having the members do them is a really good way to go.
that looks like people are joining back now.
Oh, yeah.
Oh, but it really closes in about 1 minute. Looks like some people are leaving early.
Welcome back, everyone. We're just waiting for everyone else to come in from their breakout rooms. So just, can you see when everyone's back? Like, will it, the breakout rooms sort of,
Yeah, it's ending in 45 seconds.
oh, okay. Looks like we're starting to get everyone back.
Yep. Everyone's back now.
Okay.
They're coming.
I was looking for Denise.
Okay, so we had a nice little session. I hope everyone else did. So how are we going to decide the order of who speaks first to give the challenge?
I would just run down the line of room moderators. Do you have that list in front of you, or do you need help with that?
Oh, I don't have that list, so I think you will need to do that.
I can read it off. If Shayna and number 1, if you want to go first.
So for our group, it was one of the biggest pain points for us was around social distancing and how there's so many different folks in our work environment and how each of these folks come in with like a very different perspective or different mentalities, and their issues around or their concerns around social distancing and COVID may be very different in the current time. So how do we come to this one standard perhaps, or can you give us some guidance basically on how to challenge all these different perspectives in one setting?
That's a good one, because sometimes you cannot, rationalize people's fears. So I think you have to be able to listen and be understanding, and then come to some understanding, because some people don't think it's a big deal, and some people would rather not even come to work. So I think communication is key within an organization to address this. And the state also requires training in the latest, in the standards. Since phase 2 standard, they require training. Yeah.
I guess we're going to address this one now, so I can talk a little bit too. The thing we've tried to emphasize is sort of the reason behind it. And for us, it's that if someone does get sick and you haven't social distanced, then you're likely to have to go home. Even if you don't get sick, you're likely to have to stay home for 14 days at least, and that it can really disrupt a research team or a group pretty badly if that happens. And that's really the reason for the social distancing. Even if you're not really worried about your own health so much, it's whether you're going to be able to come to work if someone gets sick. It's hard because everyone is a different place on a spectrum, I think.
Yeah. All right, and we're going to go over to Dorian.
Hi. Well, see, there my automatic lights just went off. There you go. So we had a very good discussion in our group, and we sort of came up with 3. But I think if we had to go with some of our top thoughts, right now with a limited amount of people in the space and all that kind of stuff, they're relying on the scientists to be cleaning in the labs. And how do you ensure that they are cleaning in the labs? How do you ensure that they're doing everything properly and, fulfilling that important piece?
Great, thank you. And
we're waiting at the end. Is that what it is? Sorry. Are we waiting at the end to answer everybody's question? I'm sorry.
I think you can go ahead and comment now if you'd like.
I think it makes sense to do that.
Okay, so the state standard says you need to have cleaning log. It is in the standards for reopening offices and lab. So you could have those cleaning logs posted with, the name, what was cleaned, the date, the time. That's one way.
One thing we've done is we've designated somebody within each lab group to we're calling them the quarterback. They're managing a lot of things, but this would be one of the things that they're overseeing, making sure that each group, each shift has a plan for cleaning. We made cleaning materials readily available in the lab. We came up with these little totes that are sitting there in the labs to help people remember that they should be doing some additional cleaning.
Sounds like a good approach. And over to Brian for readout. You there, Brian?
Done. There we go. Sorry about that. We had a couple of things that popped up. The first that kind of resounded was just, and it touches on cleaning, but helping to keep people vigilant in not only defending against a COVID outbreak, but protecting against proactively in all those actions. There was another quick conversation about stalled business conversations between partners and how to kind of restart that conversation. And then thirdly, lab space, maintaining 6 feet of distance in Cambridge can be pretty tight as we all outgrow our lab space pretty much a month before we move into it. So I'll leave that to the experts.
I can say something about the last one. We have, in some cases, put in some plexiglass down the middle of our lab benches. It's not a cheap solution, but in some cases we felt it bought us an additional person or two in the lab that was really worth it.
We actually, so one of our directors had the idea to actually buy like plastic sheeting, so like sheets of plastic, and instead of using plexiglass, we use big heavy duty sheets of plastic, so that's a little bit cheaper and easier to put up.
Just have to be careful about fire concerns, flammability when you do that. It's probably okay, but just keep an eye on that.
Okay, I'll definitely report back to the team.
Carolyn, any comment from you?
What I've seen done is in the case of smaller equipment that's easily movable, maybe if it's in the corner where it's a very busy corner, maybe moving it to like a centrifuge, moving it to a corner that's not used that much to try to create the space. But I know it's hard in the lab.
Sounds like a good idea. Adam.
Oh, I think there was no, I think that's my room. There was no moderator. I think
That's
Chris,
right. Do you want to do what happened in your room?
Yeah, you were there for a few minutes and suddenly
I got pulled out.
So in our room, coincidentally, we had someone from a landlord perspective, someone from an architect perspective, and then an equipment company. So the challenges was how to get everybody back at work and making sure people feel comfortable, especially when there's many parties involved, such as landlord with several tenants and the communication. So maybe I'll let Rhonda talk a little bit because I was in the room.
Yeah, I would just add to that, just also to cover one of the points was for folks who are dealing with either care for someone who's immunocompromised or if they themselves are immunocompromised, basically how to handle that situation.
Okay, so in terms of someone who's immunocompromised, we've definitely dealt with that a little bit. We've really tried to come up with a way, if they feel like they need to be on site, like some of our researchers, to really get them in a space where they're comfortable working. We have one working in basically what used to be a little radioactive materials room where he can do his work. There's nobody else in there. He feels really comfortable and he can still go home and feel safe at the end of the day. I think in terms of bringing multiple groups together, that is hard. We have you have your security staff, your janitorial staff, your landlord staff, our building services staff. I think I'm about to do trainings for the janitorial staff and for the building services staff to make sure they really are on board with what we're doing as an institution. And I think communication is really the key to that. To make them feel comfortable and trying to get questions. If people have questions, trying to make sure they ask them. We've got our signs translated into other languages for people, who might come on site and English might not be their first language, like the cleaning staff in some cases.
Great.
And one of the things that came up in the group also is increased cost with all the implementation that are done, and maybe delays, right, in terms of construction, and things being, it's hard to keep things on schedule.
All right, over to Elias for readout.
Hi, so we had one that really stood out, which was talking about visitor and vendor accountability, and trying to keep business-to-business relationships running, especially when you're just kind of at the threshold of having 25% staff in a facility. At what point do you start continuing to bring in different vendors, which is especially important in kind of EH&S and operations type roles. And if anyone else would want to talk about that, that'd be an important issue for us.
The capacity now in office space is now at 50%. It was at 25. The state has increased it to 50% now, if that helps.
Right, but yeah. More importantly, folks who aren't exactly, members of the certain company or organization, coming in different protocols in place for, external guests and visitors.
I could talk a little bit about that. We are we're limiting visitors at Broad to essential visitors, which is obviously a judgment call. But when an instrument needs to be serviced or something, someone needs to come on site, we have an email address that is designated for that. People email that email address. Someone reaches out to them and sends this vendor a set of questions, basically our screening questions for entering the facility. Where have you traveled? Have you had any symptoms? The list. Once that's cleared, then the person will come on site. They'll get asked those same questions the day they show up. They'll have to follow, and they're briefed on all of our distancing and PPE requirements. And it's very limited at this point. But I think we're moving, as we feel more comfortable with what's going on, we're moving towards opening it a bit more soon.
So are these essential relationships mostly just infrastructure, or are there any kind of financial, more kind of business partnerships that would be considered crucial? Like that threshold, I think, is very important when we think about, delays in, planned business operations.
I think I lost a key word out of what you said there, but.
Oh, just essential then being only really kind of infrastructure unless, business partnerships and operations.
Any response on that one?
I think Rhonda's frozen. We may have lost her.
Oh, okay.
I think if there are things like business conversation that can happen remotely, right, via Zoom, like in terms of you were talking about business, financial, maybe this can continue to happen in the same way. But in terms of having, like Rhonda was saying, someone coming on site to calibrate equipment, they still need to come in so that you can function. But I think communication with your vendor service provider is important so that they are aware of your policies for coming on site, and maybe looking at when they can come in, right? Maybe you don't want everybody to be in at the same time, but staggering shift and things like that.
That's a good point.
I'm sorry.
Yeah, I was just going to add, this is Ted Harding at Jounce. In addition to what Rhonda talked about, we do very similar, having people pre-register and complete a questionnaire, but we've also got all employees and anybody who comes inside, vendors, visitors, for 14 days following their last visit to the site, they have to complete that same questionnaire. And so that way, if someone were to become symptomatic 2 days later, we know about it and we can actually go do contact tracing whenever we might need to do. So that was an added feature we put in.
And one thing I want to add, this is Shina with PHC. So being on the vendor side, one thing I can add for this here is the clients that we have currently been meeting with. So for example, I'm working with a larger client currently in Waltham that is expecting validation from us in regards to a few dozen equipment. And as you can understand, this is crucial. They're about to, start running soon. So we're following a very similar structure to what Ted mentioned earlier and Rhonda mentioned earlier, where we're having to fill out questionnaires. Communication is the key here. So setting up those appointments ahead of time and the client letting us know when exactly we can come in and being strict to those timelines. So again, all of that is key to making this part of the vendor and client relationship successful in the current time.
And I would add, we actually have had to fill out questionnaires going the other direction, that the vendors are asking us about our programs. So it can go both ways, if to make the vendors feel more comfortable as well.
All right, over to Isabel.
Sorry, just unmuting there. Our group had a great discussion. Echoes a lot of the things that have already been mentioned. I guess overall, it was just the idea of how do we address a comfort level for people to return, and with that, how do we provide enough space? Kind of to what was said before, Cambridge doesn't have a lot of it, and especially these labs growing further in that kind of way, just providing that space for people, as well as providing enough work for those to come on site or not come on site if they are uncomfortable. So a little loaded there.
Isabel, this is Chris, just a quick question. Do you require people to, for example, drive by themselves in their car to work? Are they allowed to get to work via other means?
Nothing specific to that, at least at my facility. They did reimburse our parking for a while for those, so they would not have to take public transport.
Mm-hmm. Okay, just curious.
Mm-hmm.
Comments from Rhonda or Caroline?
It definitely is a challenge. I know for right now we have lab folks back on site. We don't have the people who can work remotely back. We've taken a bunch of the conference rooms and made them into break areas for 1 or 2 people to socially distance. I'm sure other people have done the same thing. We're talking about putting up a canopy in our courtyard where people can sit out there for a break more safely than inside if they were going to take their masks off and have lunch or something. The comfort level, I think another group talked about this as well, so we may want to let them ask their question. I don't know. Caroline, do you have comments on this one first?
Like we talked about staggered schedule, but some companies are also working on the weekends, and you also have to maybe have a policy for working alone and what you will allow, maybe not allow when somebody is on site alone on the weekend. A lot of our clients, once you're done with your lab work, anything else like computer work, people just go home to do that at home if they cannot social distance in the office.
Makes sense. Lauren.
We sort of talked about space from different angles because everybody was coming at it from a different angle. So with laboratory space, we started with just finding space, a discussion about, with COVID, what will be the situation for companies that are looking to locate in Boston, and what sort of hurdles may they face that they weren't facing before when it comes to moving in. And then for companies that are currently working in their space, how do you keep a staff that's so used to collaborating distant, and is there more specific distancing that should be happening in labs? Do we need to replicate what's happening in the offices or don't we? And then if companies are in their space, many companies got the exemption and did keep a good level of operations, but not all of the service providers necessarily were able to keep that level of operation. So how do you maintain your space when you're one of the few companies that are working at a high capacity with your service providers? And if you're not working at a high capacity, how do you replicate that sort of camaraderie when you're not in the office? How do you maintain that feeling of well-being? So we talked about a lot of different things related to lab space. So Chris, Caroline, and Rhonda, anything that you want to jump on that may have resonated with you, we'd love to hear from you.
What came to my mind is the word collaboration. I don't know if some of you have watched Sunday Morning, the show Sunday Morning last Sunday. There was a nice piece about design, office design, and how for the last several years it was all about the open office concept so that people could collaborate, but studies have shown that people collaborate less. People are packed together and it's hard to have a conversation on the phone. So that now there's the new thinking about design will be probably different, and they were showing some example in Europe already with new design. I know that doesn't address necessarily the lab. Labs are expensive. I mean, office space too, but I think we'll just be thinking differently about how we set up the labs, I guess. But I just want to add, if there was something in the news yesterday, and it's very a preliminary study that maybe antibodies don't last that long after someone has COVID, so we may be living with this for much longer than we thought. So
I'll add, Broad is looking at taking some of our larger conference rooms and trying to make them into much better places to do a joint kind of a few people on site and a lot of people off site type of meeting. So if there are some people on site who really need to be involved in a meeting with a bunch of people off site, you can do that kind of collaborative meeting, and it takes some AV knowledge that I don't have. But I think it's a way to hopefully pull teams together when some of them have to be on site, some of them can't be on site, more so than a Zoom meeting will do. I think something I'm seeing in our space is that we may find that we don't need as much office space as we had previously. We're going to have a lot of our office folks, home for a significant period of time. So I could see some of our office space becoming lab space. And Bro does this a lot. We are always under construction, and some of the folks on this call know that. I think we could, see some of our office space becoming lab space to help with this problem because we desperately need space to handle COVID-19 samples and, just to do regular work in the lab as well.
Makes sense. And just before we go to Greg for the final readout, if people have questions, please type them in the chat, and then we can start to address the questions after Greg's done the readout. And then when your question is read, if you want to open up your mic and comment with whoever's responding, you can feel free to. But over to Greg.
All right, thanks, Chris. So our group, kind of mirroring a lot of the topics that had already been discussed, one of the biggest challenges is with kind of staggered shifts and partially reopened at the moment. How do we and how do companies plan ahead with scaled or phased reopening? And two of the biggest challenges that were discussed in continuing with phased reopening are employees that are uncomfortable or may not want to return to the office or lab space, and also what to do in the event if the pandemic continues, as it's very likely that we'll be seeing this for a long time. And how do we approach the phased reopening and continuing to get back up to speed if we can, if it does continue indefinitely?
I can start with this one because this was the room I was in. I had a little time to think about this. I think Broad has been really conscious as we reopened that we have to be willing to go back if things get bad again. If the situation locally gets worse, we may tell some people who've been coming in that they have to go home and work from home again. And I think that may give people comfort as you ask them to come back in. If you make it really clear that this is where we are now, but we may not be here in a month. If things get worse, things may reverse. I think as we started to bring more people back in, we really felt we had to emphasize the safety measures that were in place. We have people working 24/7 at Broad doing running tests, COVID-19 tests. We have non-overlapping teams wherever possible, to minimize any consequence of anybody getting sick. We've been very fortunate that we're testing everybody who comes on site, basically, and we've been testing about 500 people who've been coming on site. We've done about 10,000 tests since mid-May, and the number of positives we found are in the low single digits. So we were surprised at how few asymptomatic people really are, or healthy people are actually carrying it. It was reassuring to us. Publicizing that without giving away the exact numbers or names of people who have been positive has made our teams feel better. Emphasizing vacation. They do want people to take breaks. Broad put in a no meeting Friday afternoons, no meeting, no email Friday afternoons. So if people want to take Friday afternoon, they can do so without feeling guilty. For the people who are on site, that has given them a bit of a breather. And for those of us who are sitting in Zoom meetings all day, it's also given us a bit of a breather. Those are some of the things. I think that we also had incentives at one point for people who were coming on site to work, and I think we've eased off on those now. But that's where we've been with this.
Caroline, anything on this one?
I personally, I try to keep up with all the new information, because when there's our difficult situation, people are coming up with great innovation and ideas and how to work differently and thinking outside the box. So, yeah.
Great. And so we've gotten, we're getting a couple of questions in, and we're getting close on time. So, Dorian, I think I'm going to pass and just go to the questions, and then if we have time, go back to you if you don't mind.
Yeah, no problem.
All right, we have a question from Daniel. Dan, you want to unmute yourself and you can read your question if you'd like?
Yeah, absolutely. So yeah, my question comes, and this is basically from other clients I think kind of running into this issue, but how are you guys going about training new employees if you bring on, say, a new research associate? Typically, you have to be in close proximity in order to do that training. So how do you go about this when you have to maintain social distancing rules?
So I can start, Caroline, and then we've really emphasized this, or tried to emphasize this with our lab groups, that we don't want them closer than 6 feet. So we came up with a list of options, starting with where you have procedures, please, share the procedures ahead of time in writing so people can look at them and ask questions. If you could do them as a Google Doc or something, there can be discussion. The idea of the use of cameras when you do a procedure so that someone could watch either live or you could videotape whatever you're doing. The idea of just, one person does something and you step back and let the other person come in and take a look at what you're doing. You don't necessarily have to be shoulder to shoulder with someone. They could be far enough away from you, but still in the lab with you and learning from you. That's where we've been trying to go with this. Other people have other suggestions?
Same thing I've seen. I think the main challenge is when you have someone like a student or a co-ops, and that's sometimes difficult if you're going to show them how to do pipette or do something they've never done before, but maybe with a video that would be helpful.
Okay. And before we go to the next question from Claire, I just wanted, which is about testing, I just wanted to say that next, I think it's the 30th, which I think is Thursday, next week, we do have a forum that's focused on testing and how companies can implement testing. And that will include someone from the Broad. So please register for that. But in the meantime, Claire, do you want to ask your question?
Sure. I think I was curious how other companies are handling the testing process. I'm sure other people are getting lots of requests. Employees are interested in getting tested, whether either it's a necessary thing based on travel or just a personal preference thing. There still seems to be a lot of mixed information and controversy regarding testing results and how useful they really are, as well as now in Massachusetts, we're seeing delays of 1 to 2 weeks between an actual test and when people are getting the results. So how are people navigating those challenges?
I can talk about this, but we have the advantage at Broad that we have the in-house team running tests, so we get our results really quickly. So it's less of an issue there for that. There are lots of challenges when you're testing people, especially if you're getting back asymptomatic positives. What those mean at this point is really hard to tell. And so we're working closely with our occupational health teams and us taking each one individually when we get a positive result. We're limiting very carefully who gets the results as well. Obviously, that's a major issue. Caroline, what do you?
Yeah, there's some false negative, false positive. There, sometimes people are also trying to do shortcuts and go to tests that are not necessarily like antibody testing. And what do those mean? There's virus testing, antigen testing, antibody testing. So there's so much information, so much confusion. I don't know. I'm still not convinced.
Yeah, I'm super excited about it.
Yeah, I think we'll have maybe some more answers next week. So, all right, over to Michael from Editas.
Hi, I just wanted to actually, I had one quick comment about the person who asked about the social distancing. And because I'm hopeful, and this is how I think about this, that, when you're in the lab, you're in the same space as people. I hope that when you're outside of the lab, you're really thinking about your interactions and, maintaining those interactions outside, because I think that's what really it all starts and ends. Is if people are responsible outside of work, they're going to be responsible inside of work as well. And I know at Editas, sometimes 6 feet away just isn't possible. So we do our best, but I really hope that people spend time thinking it outside of work as well. And then my question was, everyone worked from home starting in the middle of March. How do we incorporate what we've learned about what works from that as we transition going back to work? I don't foresee us just all going back to work one day and it working out, but what kind of things, how should we think about that going back to work? How can we best incorporate the things you've learned going forward?
I think a lot of people at Broad have learned that they can work from home, their team members can work from home, and we didn't even realize that at the time. I'm sure a lot of people have found out too, that the concept of everyone working from home was such a foreign thing. So there's tons we can learn in terms of improving the traffic situation. I commute from New Hampshire normally. there is a lot to be learned, and I think we have to not forget it when we can go back in, that there may be advantages to maintaining some of this. Caroline?
And we all explored tools that were available already, and like Zoom, and we never, or Ring Central, and we never necessarily took advantage. Maybe we used the phone app, but not the conferencing with the video. So I think we learned the tools and how to use them and make them useful for us.
All right, and Denise, did you have anything you wanted to say before we close out and have people go back to their next meeting? Or
I just want to say it was a pleasure to give the opening, and thanks everyone for tuning in.
Great, thank you so much everyone for coming. Thank you, Jess, for helping us do our breakout rooms, and please join us next week. We'll keep this conversation going about testing. Stay safe, everyone.
Thanks.
Thank you.
Thank you.